Welcome everybody to our treatment session with Chris in Perth and her patient Alexis. Hi ladies, thank you for joining us.
Hi.
This is just so exciting. You know, I'm in South Africa, Chris is in Australia, and we can collaborate and we can kind of put our minds together to help Alexis and also just to problem solve a few issues that they've had with her treatment. But Alexis, why don't you introduce yourself to everybody and just give everybody a little bit of a summary of your injury and a bit of the journey as to where the journey that you've been on.
Yeah. So, hi, I'm Alexis. I was misdiagnosed in January with a broken wrist, and so was put in a plaster cast, and then subsequently a splint. So then I was
you were left for quite a while.
Yeah,
with that plaster.
Yeah. So I was essentially in that restricted space for 7 weeks, and then by that stage I had no rotation or extension in my right hand. And then it was maybe a couple of days later that I was actually diagnosed with CRPS. And then that journey has started with therapy and holistic care. So we've had obviously neurologist, I've had hand therapists, I've had doctors, I've had very lucky to have a CRPS specialist who's in Queensland, who's been talking me through quite a lot and who referred me through to Chris. So it's a team of people that have been helping me holistically recover. Yeah.
Okay, so you were put into a cast, immobilized. Most likely they blocked your MCP joints, am I correct? So you couldn't make a full fist within your cast. So they took away your motion and then a few days later diagnosed you with CRPS because you couldn't move.
Probably six. Was it later?
It was
later.
Yeah. So
she was in pain in the cast towards the end. Is that right?
Oh, all the way through.
All the way through. Actually, sorry, you woke up. So Alexis is actually a musician, and she originally went to attend, presented to hospital because she woke up with pain. She had a busy day recording on the piano, and she types a lot at work, but she hadn't done anything different to what she normally do, but woke up one morning with a lot of forearm pain, had to present to the ER, was put in the cast, and then but was in pain throughout the whole process and kept reporting that. But it wasn't until towards removal of the cast that you have a friend who's a neurologist, and
so I got a second, because when I went to the orthopedic clinic, and they took me out of the cast, that was 7 weeks that I'd been immobilized, and I could not, no rotation, no extension, and I was in pain, and they just said, leave it, do therapy, didn't get a result or any sort of closure on that. And then I went and got a second opinion from a neurologist in Melbourne, and then from there I was diagnosed. So it's like 2 months after.
So we almost need to take a few steps back and work out what led you to A&E, what was going on. So at that time you were doing a lot of typing on a keyboard?
So nothing, so there was no episode or anything. I just woke up one day and it was very sore, extremely sore to rotate or any movement. Any rotations of the wrist. It was all wrist based, which is why they assumed I'd broken my wrist.
But you had no trauma.
You had no trauma, but nothing. You might have, but you are a musician. So it's sounding like a little bit that there was a little bit of a repetitive strain injury. Were you practicing a lot?
I've been doing this my whole life. So it was not like I was rehearsing up to tour or which I've done previous years. At this point, it was actually a pretty minimal, the amount of work that I'm doing is pretty minimal. So there's probably been other times in my career where I've been far more. So, but there was no strenuous things. The only reason why I noticed how bad it was on that Sunday when I woke up is because I went into the studio and I actually had to do like a session, and I was like, oh, this is sore. And then really I couldn't, even driving, like reversing, like turning the wheel, that was probably the breaking point. The fact I couldn't even reverse my car, that was the breaking point of me going into the ER. Like, yeah.
And then how long were you having therapy before you met Chris?
So I'd got the diagnosis in Melbourne, and I'd gone into a hand therapist there, and then I got all of my referrals back in Perth. So then when I got back to Perth, I'd spoken to Rosie, who specialises in CRPS, and she referred me through to Chris.
Okay. So Rosie Gospel also still treats Alexis fortnightly right now. She was weekly, now fortnightly as well, doing other CRPS treatment.
Yeah.
Okay. Tell us a little bit about your CRPS treatment.
So Rosie essentially has been like the main drive. Once I got referred through to her, she's been the main driver, actually informing me, educating me about, and very much like giving me the referrals to someone who specialises in TRE and counselling with like chronic pain, to sort of help me on that side of things, referred me to Chris to actually have someone physically with me. And then through that, she's been in contact with my GP, you know, when we've been trying to get referrals through to the hospital in regards to hyperbaric oxygen chamber treatment. So
nice.
we've
very holistic.
Yeah, very holistic, trying to like come from all sides, and because Rosie's so informed with CRPS, like we've gone through different kinds of supplements. We've talked about, you know, stress levels, and we've talked about dietary things, and so we're trying to look at every sort of side of it and just coming at it from every side, and
Awesome. Okay, so let's talk about your hand, because we've all seen the video. When you first met Chris, you could really hardly move your fingers. You had a tremor. You couldn't rotate your wrist. Chris, what were your thoughts at that time?
So I definitely felt like it wasn't a repetitive overuse, that had been misdiagnosed, and as such, she had really her nervous system was freaking out. She was really a bit of a mess, poor thing.
Yeah.
I'm in a lot of pain. So it was definitely, even though I knew she had been in a plaster, that was a little bit of a concern of mine, just to have to introduce her to that, being as that she had already been in a plaster, and having to talk to her about that. So we had a few sessions just to start with, trialing a few other options. We did a little bit of taping that helped to settle her rotation a little bit, but it didn't help with the fingers. We've been doing some gentle desensitization. And am I jumping ahead too much? I might be jumping ahead too much.
No,
that's okay. So I was concerned a little bit about how we would go, but we braved it out and started with the intrinsic minus plaster 2 weeks ago, and there were huge improvements even in 2 days. And over the last 2 weeks, Alexis is turning into a happy human. Happier human.
Less of a shell of a human.
She's getting some sleep. She's able to cut down a bit on her medication now. We've got
swelling's coming down.
Swelling's coming down. Her nervous system is definitely calming. She's still having a bit of trouble with extension, but that's because her MCPJs have not been able to straighten. So our goal today, she's straightening quite well. Initially, our first plaster, we couldn't straighten into the hood. We worked our way into that, so we've cut the hood off, and now we're able to straighten. But her MCPJs, as they weren't straight in this cast, she's only straightening, to about 30. Yeah. So ideally, we want to get her back into full extension of the MCPJs and work on that ability to fully straighten. The shakiness has settled. She's able now to hold things. So she's just telling me this morning how she can hold her keys, pick up a washing basket now, becoming a bit more confident with use.
Because all those activities, I just got sharp pain all the way up. Up my wrist, predominantly my wrist, but up my arm. And that's one thing that the cast has really lessened the pain that was happening around my wrist. It's just allowed, especially even like the nerve, like it's just calmed everything down. Thank goodness.
So how did you feel inside the cast?
Sorry, what was that?
How did you feel
inside the cast?
Well, initially putting the cast on that first day, because my hand was still so swollen and all of the nerves on the outside of my hand they're still quite sensitive and reactive. So I was getting a lot of pain and a lot of like burning sensation. So getting in the cast was quite uncomfortable, to say the least. But it definitely settled down in a couple of days, and once we taped everything to try and limit the amount of swelling and just to co-band it. So we did as much as we possibly could to just lessen the reactions.
It's great, because the reason I ask, a lot of patients would be petrified to go into a cast to use this technique, because the cast created a lot of the problems for you in the first place. So it was
I was very, very trepidatious, and I mean, Chris had given me a week to think about it. I'd also had time because her and Rosie were in contact, and then Rosie and I discussed it as well. And then, Chris was very kind to say, like, if at any point, if it's too much, we'll just cut it off. So, So, you did that. So I think, the support from Chris and Rosie to be like, if at any time it's too much, you just let us know. So that was, I think, of course, it was a bit scary going in, and definitely the day that we went in, my body was not enjoying.
You hadn't had sleep. You hadn't had sleep.
No, my body was like high alert. But the fact that exactly.
And did you feel safer, cocooned, positioned better? And also, did you feel that ability that you now had to move your fingers, which you didn't really have before?
I think because there was so much isolated pain around my wrist, that anything, even just like slightly touching or putting a little bit of like force into the fingers, would just be sharp pain. So I think once that sort of isolated that, I had an opportunity to really just focus on doing that movement, and then that's allowed some, strength, because we've just been isolating. But it's been a lifesaver having the pain, because that was just excruciating. And it would I would tremor in the middle of the night. It would just start to tremor. So that's just been a lifesaver.
It's really fascinating how the cast actually does settle tremors, and I think it has a lot to do with the lengthening of the tissue, the lengthening of the nervous system, and that calming effect is combining it with movement. So the medical profession will tend to immobilize when somebody's in pain, when they feel they need to protect them, but actually we need to do the opposite. Could you just pop your arm on the table for us and just show us currently the movement that you have, just actively flexing and extending your fingers as quickly as you can?
And then individually, they're not so, it's a little shaky. That's the next challenge.
Especially because Alexis is a pianist. So she's very much interested in wanting to get her individual finger movement back without that shake. This cast is definitely ready to come off. It's moving a little bit. We just want to get those MCPJs back a little bit more.
And still, these knuckles are quite temperamental. We've been really fortunate that my thumb and my first finger of, just
the thumb settled a lot. That was really shaky.
It was really shaky and it was super swollen. So that's
just
really.
Turn your hand for everyone to see that Chris has not reduced your mobility of your thumb at all.
No.
What is struggling is your little finger.
My little finger is a bit delayed. Yeah. So, but doing the app that Rosie, the
Vanilla Hands,
the recognize, like that,
yes.
We started with a 2.5 second delay with my brain recognizing a right hand, and we're now getting to a point where, my response time, before it was just so delayed.
So the cast is definitely sped up a lot.
Yes.
It's really improved her ability. It's the brain hand connection.